Thank you, Andre. And can I welcome you all to this, our October virtual cabinet meeting. The year's gone quite quickly, really, and we've only got sort of like 2 more months to go towards Christmas. But I think we're getting the hang of these online meetings a lot better. Present at the meeting tonight are members of the cabinet and a number of council officers. If they are to speak in any debates, they will say who they are. Before we proceed, I'll just go through the normal sort of guidance for these meetings. Can I remind everyone to turn their mobile phones to silent? There's nothing worse than some of the jingles we hear in the background. And can I also refer members and officers to the published protocols for holding virtual meetings? In particular, can you note the following? Members of the cabinet should ensure they have their videos on at all time, but can you please put microphones on mute unless speaking? If other members and participants should switch off their videos and put microphones on mute until they are invited to speak. If anyone wishes to speak at the meeting, can you please use the hand signalling process so we can make sure just the right people are called in, and we can make sure that the have an opportunity to sort of control everything rather than everyone speaking at once. In case of a technical problem, the meeting will adjourn until the issue is resolved. If the technical problem persists and the meeting is incorrect, the meeting will be adjourned and rearranged for a later date. If it's just me having a technical problem, then the chair of the meeting will move to Councillor Ferry as Deputy Leader of the Council. And just to remind you all that the meeting is being audio and video recorded and will be available to watch, listen to on the website straight after this meeting. Right, so if we move straight to the agenda, item 1 is apologies for absence. I haven't received any. If anyone's aware of any that we need to record. No. The next item really is not agenda, but I just want to sort of make an announcement, 2 announcements really. So as we're all aware from news from across the country, the second wave of COVID has started, and we are also seeing a rise in infections within Harrow. Today's level in Harrow is at 78.4 per 100,000, which alongside much of North West London puts Harrow in the red category. Due to the fast moving nature of this virus, we have a verbal update on the cabinet agenda tonight in order that the most up-to-date information can be presented. And this also sets out the challenges the council will face over the next phase of the crisis and how these challenges will be addressed. The presentation that will be used has been uploaded to the council website. With Cabinet's agreement, I propose that we move item 8, which is the verbal update from the Chief Executive on COVID-19, up the agenda so we hear it after item 4, which is public questions. Is that agreed? I see people nodding in the up and down assertive moves. I'd also add that the past few months have been quite hard really on the council, and the COVID crisis has shone a strong spotlight on inequality within the borough. We're also more acutely aware of the pressure points where we as councillors are spending a lot more time over during the days, evenings and weekends, and over the coming months and into the spring we can expect more of those lot of late nights and long days. So I therefore want to ensure that Cabinet can respond better to the forthcoming crisis, and so I'm making some short-term changes to the setup of Cabinet. Firstly, Barsha will be leading on the corporate qualities agenda, which is a role she previously held, and will focus around the terms of the Black Lives Matters motion carried at our last full council meeting to ensure our policies and ways of working are addressed. This work has already started with a cross-party group being set up, and the 3 focus areas being addressing inequality in life outcomes, which flows from the borough plan, a review of council services, and the 3rd area will be action by the council as an employer. Just to be clear, Adam will, through his responsibilities within HR and staffing, continue working through the HR director to ensure the workforce equality agenda is delivered to plan and as per the constitution. This is an important area for us as a council, so I will continue to have strategic oversight of equality and tackling inequality in Harrow, and continue to chair the corporate equality group. To give some time for Varsha to take on this huge role, responsibility for leading on the council's enforcement activities that are within environment will move to Krishna. These changes will be formalised at the full council meeting in November, but it just gives some notice about how we move forward in the sign bin, and I will be writing to the monitoring officer to outline that for any decision making is likely to take place or required. So we'll just move on to item 2, which is declarations of interest. Does anyone have a declaration of disclosable pecuniary or non-pecuniary interest from members of cabinet? Oh, sorry, they've been published on the website, so if there's anything that comes notifiable during the meeting, can you please let us know? And is there any declarations from any other members present in the virtual meeting? Richard Ormond.
I did email this in, Mr. Leader, but in relation to question 7, I should declare that I'm a governor of St. Teresa's Catholic Primary School, which question.
Thank you very much, Richard. That's duly noted. Petitions. Moving on to item number 3, which is petitions. I haven't been notified of anyone that wants to present a petition tonight. No hands raised. So now move on to item number 4, which is public questions, and that's from Mr. Ian Mandel. Ian, I think you're on the phone coming in, so did you want to ask your question?
Yes, please, if I could. Can you hear me?
Yes, thank you. Yes, you can. Yeah.
Right. I represent the shopkeepers on Honeypot Lane, and we have a major problem there with the barriers.
Sorry, Ian. Sorry.
Yes.
Sorry. Can you read the question out first, and then when
right.
you answer the question, then you can come back with a supplementary question.
Can you? Okay. Can you please explain why the parking barriers at Honeypot Lane are still in place? The pavements outside our shops are 8 foot 5 inches wide. The Stanmore has no barriers whatsoever. The barriers have totally ruined the businesses on the parade. There is no footfall and businesses are on the point of closure. The council are supposed to be supporting shops, not killing them off. The other thing I noted today was the cycle lanes. The emergency services are having great trouble getting up Honeypot Lane. When they get to the service road outside our shops, they have to stop and wait. They cannot get through because of the cones for the cycle lanes. And what they've begun to do is go on the wrong side of Honeypot Lane to reach the lights, and that is police, fire and ambulance.
Okay.
So
Ian,
that's
sorry.
My question.
Yeah, thank you very much. Sorry to interrupt you, but if Varsha, did you want to answer the question, Varsha? If Varsha answers the question, and then you've got a chance to come back with a supplementary question.
Okay, thank you for your question. As you know, these measures were put in place following government guidelines to support our residents with social distancing and being safe. Following our monthly review, the footfall has shown to be increased month on month. However, at this time, it is very important and paramount that we keep these measures in place, as the infection rate is on the increase in Harrow, more than 78 per 100,000, and with possibilities of further restrictions on the way.
Thank you, Varsha. Ian, did you have a question?
I heard that, yes. Yeah, I had. We had a pamphlet round from Street Space for London, and in it, it says that the measures are located outside shops with narrower footfalls where there is higher footfall. And you have seen an increase in pedestrian numbers. That is a total lie. There is no footfall outside our shops, and there's at least 3 shops on the verge of closing down. There is absolutely, the pavements are wide enough to get 2 people going either way. And the barriers are serving no purpose whatsoever.
Okay, so as I have explained, these are government guidelines for safety of residents. We have, as we said in our TARSAT meeting, that we would review them every month, and we have. And we have evidence to show and survey that shows that numbers have increased, the footfall has increased. So I can only tell you what I know is my facts from the officers and the staff who have done their work.
Barsha, where has it increased? No one has been down outside our shop. I've got
Which particular shop is that? Tell me.
Honeypot Lane.
Yes, I know Honeypot Lane very well. Which particular shop are you talking about?
I'm awards for you. The chemist further up the road, his CCTV, we checked it. There is no footfall there. Absolutely no footfall. Someone is not telling the truth on this pamphlet.
Right. Ian,
yes,
it's Graham here. We don't want to get into a debate right just before the meeting. What I'll do is I've got your. If you leave your telephone number with the Democratic Services, I'll give you a call and talk you through some of the things we're actually doing. And make sure, because our priority is, as fast as just set out, so, we've got a fine balance to make sure that people are safe when they're out on the streets and the highways. But I'll give you a call afterwards to save having a discussion at this moment in time.
Okay.
Okay.
Graham, let me make one offer to you. Come down to see me at my shop, and I can show you what I mean.
Yeah, if I can, I will do. But we'll talk about it first. Then don't go yet. I'm trying to write your number down.
Oh, it's 07710.
Yeah, it's a public meeting, so I didn't want to sort of
say. Oh, right.
Councillor Henson, I've got Mr. Mandel's number.
Excellent. So I've got your name and number, so I'll give you a call, Mr. Mandel.
Okay. I'll stay listening anyway.
Okay, then. Thank you very much. We now move on to item number. We're moving to item number 8. So, as we just agreed, and I'd like to introduce our Chief Executive Sean Harris, who's going to go through the presentation of the COVID. Sorry, it's not that. What's it got? We're going to go to the COVID update, the verbal update from the Chief Executive. Thank you.
Thank you, Leader. Can I just check, is that on the screen appropriately, and can people see that?
Yes, thank you.
Thank you very much. I will try and be as brief as possible, but obviously, as you said in your introduction, because things are moving quite quickly, it's not always possible to write a report in advance which covers all of the issues. So felt it would be helpful on this particular occasion to bring an up-to-date presentation of the situation in respect of both what the position is in Harrow and also the council's response. So if I can start, and as you know, Councillor Henson, we have both been involved in weekly meetings now with other leaders and chief executives across London, where we receive detailed briefings from Public Health England about the situation in London, and also supplemented by the work of our own Director of Public Health in Harrow. So it's very clear that the COVID second wave is now here, and case levels continue to rise in Harrow, and has continued to do so over the past few weeks. Certainly until around a week ago, there was a lot of issues around London's testing capacity being reduced in order to allow capacity to take place in areas around the country that had higher levels. And as a result of that, Public Health England are confident that the published levels in London are probably a significant underestimate of what the actual levels of community transmission are. That being said, as you've reported already, Harrow's current level is 78.4 per 100,000, which alongside much of the rest of North West London puts Harrow in the red category. It's worth obviously mentioning that places such as Manchester are at over 500 cases per 100,000, and there are many places in the north of England where they are seeing levels above 200 per 100,000. But nevertheless, Harrow is now in the red category, and the expectation from Public Health England is that London, or certainly large parts of London, may be above 100 per 100,000 within the next week or so. And in broad terms, although the absolute level is important, it is also the case that the the trajectory of the virus and its community spread is going up in London, and that it is believed to be significant in London overall. But I think it is important to say two things: that the levels of community transmission and virus levels are not anticipated to be at the same extent at this stage in London as places in the northwest and northeast of England. And very positively, and I was on a call this morning with NHS colleagues, this situation is not currently translating into significant increases in hospital admissions or deaths from COVID-19, but there is a small increase in both of those measures. I think the other thing which is also clear, and obviously there's been quite a lot of speculation in the media around this, is that there are set to be from next week 3 levels of intervention, starting with the measures that apply nationally, and then with 2 further escalation measures depending on virus levels. And certainly once you reach 100 per 100,000, there's certainly a consideration about whether an area might move to the 2nd level of intervention. So therefore, I think whilst it's perhaps not imminent that London and Harrow will see further restrictions, I think that it is a reasonable expectation that if the increase in the spread of the virus doesn't slow down over the next few weeks, that we may well be in that position come the end of October. So that's the position in terms of where we are in relation to virus levels and the 2nd wave. And as you've already mentioned, Councillor Henson, the council is operating across a wide range of services and activities to support measures to promote compliance with COVID-19, everything from promoting the hands, face and space mantra, including recently developing videos for the use in the Romanian and Tamil communities in order to make sure that we spread our engagement as far as possible, and also working with local people and businesses to comply with existing measures such as the rule of 6, and also the way in which the hospitality industry in particular needs to operate in responding to the virus. And as I think yourself and Councillor Palmer have already mentioned, we are in this situation where we are seeking to strike the right balance and maximise the position where we are able to live with the virus, which is very much what Public Health England have been advising us to do. We need to ensure that public health is protected as much as possible, that education, schools, colleges and universities are enabled as much as possible in order to minimise the impact, particularly on young people, and as much as possible we continue to support the local economy, and that can operate as safely as possible across the broad range of local businesses. And as you'll see going forward, this is clearly creating significant demands on the council, both politically and managerially, and at both as an organisation-wide level and also in response to individual services. And the council in particular, and I think we are at the point where we need to start talking about our role in relation to the 2nd wave, undertaking a multiple number of roles to support local people at this particular point. So just, I suppose, a bit of a snapshot before I go into detail. Much of our immediate response is being about continuing to run the many hundred services that council have in a COVID secure 19 way. There's almost no service that hasn't been impacted, and we've had to make a series of adaptations in order to make this work well. The vast majority of our staff are now very effectively working from home, but there are many staff who are actually continuing to work in the community and deliver services in the front line. But many of our services, for example, in children's and adult social care, are now being delivered in a mixed way, with some face-to-face work and some work done virtually. Big emphasis on communications, both general messages to local people and businesses, but also targeting specific groups and communities that are harder to reach and where we have evidence that the spread of the virus might be greater. Strong focus on education, engagement and ultimately enforcement for local businesses and local people. Lots of work to work with businesses in order to help support them meet COVID regulations. I have to say overall, the feedback from local businesses in Harrow has been very much that they are keen to comply with the regulations and want help and support from the council to do so. Enforcement has been our last resort, and that will continue to be our approach as we want to support local businesses be as effective as they can during this period of time. Council also has a significant role to develop its own local test and trace capacity. At the moment, it varies from week to week, but probably somewhere between 2/3 and 3/4 of test and trace contacts are resulting in that being successful, which is still leaving a significant minority of cases where that isn't the case. That particular task is being rolled out to councils who have much better fix in terms of the local community, and particularly some of those people who are less easy to reach. So we'll be rolling out our contact tracing arrangements, given the fact our environmental health and public health staff are in place to do that by the end of October. And finally, from next week, we will be paying out payments of £500 for people who are on low incomes, who need to self-isolate as a result of being either tested positive or as part of that whole test and trace system. There have clearly been concerns about the economic challenge for people on low incomes being able to do that, so that the grant that's being put in place is very welcome, and the council will be implementing that going forward. This next slide, which I will then follow up with 4 individual slides for each of the pillars, is I hope a good illustration of the breadth and depth of the work that the council is undertaking in relation to our response to COVID-19. On the left-hand side, there is a series of essential services that the council is running, which is needing additional help and support as a result of the demand that's put in place because of COVID-19 and anticipated to be the case in the second wave. There's also a series of existing services that the council has put in place to respond to COVID-19, which will require additional support in the second wave. There are also a series of new and enhanced resident and business support measures, including the self-isolation benefits that I referred to earlier, and also obviously the work the council has been doing through its community hub. And also, as an organisation, we are undertaking a significant number of reviews in order to make sure we're preparing effectively for the second wave, including examining our business continuity plans and also undertaking a significant number of risk assessments for our buildings. It's not my intention, Chair, to go through each of these bullet points and slides in a lot of detail, but this is the first set of detail which looks at existing COVID-19 services that will require additional support. We are involved in establishing local testing facilities. One is about to open in South Harrow, and we are looking at other sites as well, soon keen to identify a site in the east of the borough, looking at making sure that the PPE is in place both for ourselves and social care. Obviously, I've talked already around enforcement and how we advise and educate the public, and also around communications and engagement. And also there's a significant role for our internal HR service to support sustained home working for our staff, and ensuring that we can support our staff to be as effective and as productive as possible in this period of time, given the demands that's been placed on the council. Also, we've got a series of new and enhanced resident and business support activities. Already mentioned track and trace, the community hub, which may well get reactivated in a significantly greater level of detail if shielding reappears in any form during the winter. Big focus around flu jabs for staff and for councillors in order that we can reduce the potential impact of normal winter pressures on the NHS, and also reduce the risk of people who may have flu and COVID simultaneously. The self-isolation benefit: if there is a local lockdown, the council will have access to further grants for local businesses, and that we are using our contact centre to both reach out to vulnerable residents and also to support the test and trace arrangements. We are also developing our work around reviews. We are doing a review of all our business continuity plans to ensure that the services that we are running throughout the winter are as resilient as possible, and that in every case, if we do get either spikes in self-isolation, staff sickness, or other factors that come into play, we are in a position to be able to respond effectively to that particular work. And we are already putting in place our governance arrangements and our emergency planning arrangements, where we are running a gold, silver and bronze arrangement in order that we can deliver both our operational activities, for example, in partnership with the police in the town centre over the weekend, but also that we are strategically planning for our work on the second wave. So hopefully that gives a good sense of the breadth of the work that we are doing. So that's picked up some of the examples that we are doing in detail in terms of our response to the virus. But also we are thinking carefully about what our strategic response as a council is. As the Prime Minister said on his national address a couple of weeks ago, it is likely that the country's response to the second wave will last for 6 months, and we are certainly working and planning on that basis. It is also the case that, as the Chief Scientific Officer and the Chief Medical Officer and the Prime Minister have said, the situation in terms of growth of cases is likely to be only in one direction in the short to medium term. We should expect to see the number of cases continuing to rise over the next few weeks and as we get into the challenging winter period. And we should also anticipate there's likely to be, at some point, some tightening of measures which the council will also need to support the implementation of. And all of this needs to be balanced with the council's business as usual and our existing priorities. And it will be important as we go forward, and I will continue to report to the Cabinet and to members generally about how the council is going to be balancing out all aspects of our response. And importantly, the council's officer leadership team, supported by members I know across the council from all parties, are very keen to ensure that we have the right level of support and organisational and staff resilience as we tackle the challenges of the next few months. I've also here, Chair and Cabinet, identified some, but not all, of the strategic priorities that the Council is also working on in parallel to running our services and responding to the pandemic. Examples such as the delivery of our new regeneration partnership, as is later on the agenda, the significant challenge that the Council has for its finances in the coming years, partly as a result of responding to COVID, in potentially the significant challenge of preparing for a set of elections for the GLA in May next year, our response to the Black Lives Matter and Equalities agenda, the climate emergency and health and social care integration. And these are other pressures and challenges that the Council has alongside service delivery and responding to the pandemic. So just in conclusion, Chair, hopefully this has been a helpful and useful update for the Cabinet about where the organisation is at the moment and our response to COVID-19. I think that in a difficult set of circumstances, the Council has dealt with the COVID emergency very well so far, managed to continue to run services, establish new services and maintain a high quality of interaction overall with local businesses and the local community. Obviously, as the second wave of the emergency comes along, we are in a chronic rather than an acute position in respect of continuing to manage across a broad canvas over the next few months. It's a complex situation. We are running our services in a COVID-19 environment. We are dealing with a growing emergency where those pressures will increase. We have been given and we welcome many of the significant extra tasks that the government has given us in order to help support local people. And we are also seeking to manage a number of key projects and priorities as an organisation. And it is clear that we need to make sure that we have doing all we can to maintain organisational resilience, capacity across the piece amongst our many extremely dedicated staff at all levels who have clearly risen to the challenge and will continue to do so. But we must make sure that we continue to support them over the next few months. I think the situation that I set out there in terms of the complex situation is only likely to get more complex if the situation in relation to the second wave continues to increase, and it will probably require decisions about priorities and expectation as the second wave identifies and as we see some of the challenges that we would expect to see over the winter with the normal pressures on services and the NHS. And I think it's important, Chair and Cabinet, to say that this situation is kept under constant review, engagement both with the Cabinet but also on a cross-party basis, and we'll ensure that we bring back, both in informal and formal meetings, the implications of balancing the completing demands in order that key decisions around that can be taken by the Cabinet in due course. Thank you, Chair. I hope that was a useful update.
Yes, thank you, Chair. It was very useful.
Would you like me to take the presentation down, Chair?
If you could, yes. I've seen one hand up from Paul. I seem to have an echo. Paul, did you want to ask your question?
Yeah, I have three questions. The first one is just really following up on a public question, because you mentioned economic recovery, and the public question is very much about the effect on small businesses. I had a very useful discussion with council officers this afternoon about the pedestrian spaces programme, and one of the things I'd just like to ask Councillor Palmer is, when you review these schemes, can we try and be not it has to all happen or none of it happen to each scheme? Because I think there is the opportunity on some of these schemes to look at those shopping parades individually and take a view as to whether or not the barriers all the way along are necessary, or whether there's just particular pinch points where there might be an issue of people needing that extra pavement space. Because I have to say, my experience of going to those sites is that the extra space isn't used particularly, but it might be that there's a particular area, for example, outside a particular shop, where there's a large queue sometimes, or there's a large group of people at certain times where you need that extra space, but maybe you can then open up some of the other parts of the parade for parking or deliveries or for other use. And I just think, now that we are, looking at the winter when people won't be walking quite as much and we're more likely to use cars, I do think if we can look intelligently at these things and try and be where we can be smart about these things, will be really, really helpful. But I think we'll do a lot to reassure some of the businesses in those parades that the council has their interests at heart, as well as obviously protecting public safety. I don't know if Vash wants to come in on that, and then I've got two questions for Sean.
Okay, thanks, Paul. Just to reiterate, obviously these are put in for 6 months temporary. However, we are working with the businesses where we've come across issues with deliveries, etc. So it isn't that we're just having a closed mind. We are looking at the bigger picture as well, as you have alluded to. So we will again look at that as we do our reviews and see what can be done. We are trying to work with the businesses, and we do visit the businesses. It's not that we don't participate and we're just there, doing what we think is just to do it. We're doing it for a good reason, and we are participating with the businesses as necessary, so that they can get the support they also need.
Thank you. And as I just appreciate it, we just try and have it doesn't have to be the whole scheme going or the whole scheme staying. It might be bits of the scheme need to stay, but other bits don't. And it'd be really, really helpful if you could look at that. My two questions to Sean, I might as well do them both together. One, what will be really helpful, I think, going forward, and I understand the difficulty in predicting the future, given how fast the future is happening at the moment. But just some sense of how we are weighting our different priorities, and some sense of which ones are going to have to become more important, which ones are going to have less important. Again, I get that's hard, but there's such a long list of both services that might need help, but also the strategic priority list has things that are very much time limited and urgent. So, for example, the elections in May 2021, you can't put that off unless the government nationally decides to do that. So that has to happen. Whereas there are other things that could slip a bit if you needed the capacity elsewhere. And I just think a sense of that would be very helpful. So we could talk about that, and also just on the testing site in South Harrow, I think some comms work and maybe some, I picked up on Facebook quite a lot of concern by some of the residents around there, and it's particularly around a route to schools and how they can get their kids from their house to the school without putting themselves or their children at risk to the people who are waiting, because it's a walk-in centre for COVID testing, and just how that can be done. I mean, I get that these things have to go somewhere, and particularly if it's a walk-in centre, it clearly needs to be within walking distance of where people can come from. So unlike drive-in centres where you've got a bit more flexibility, but I just think a bit of comms effort on that might be really appreciated by the residents, and maybe a bit of how we plan that site. Obviously it's together with Public Health England and NHS, but how that site is planned might make a lot of difference to how the local residents see that site.
Thank you, Paul. I just I suppose in two things. I mean, I think the first thing that I was keen to do and wanted to share with Cabinet and councillors generally, I think is rather than come along in X number of weeks' time and say we are in a situation where we can no longer do X, Y and Z, and that's a decision that we've sort of taken on an emergency basis. It's quite keen to have this conversation before we are at that point, which I think has partly been the purpose of engaging members both informally and formally, because as things stand today, it's a challenge and it's a stretch, but we are more or less managing to juggle all the things that we've identified. But I think that certainly every meeting that I've been to over the past 2 to 3 weeks has suggested that the situation is going to get more and more challenging, and the words that Kevin Fenton used last week was we're at the beginning of a very long haul over the winter, and I think we should expect the situation to get a lot worse and also measures to get a lot tighter. I agree, Paul, I think some of this effectively prioritises itself for the reasons that you've said, things like the elections, things that are time limited, and also those aspects that are about virus suppression and activity, which inevitably is about doing the right thing at the right time. I think that what we're doing at the moment on a managerial level is asking senior managers to identify where they are most concerned about needing more capacity, and also to analyse where, if we were able to move staff around, where those staff might be, and therefore what the subsequent what the consequence of that would be. And that work is currently ongoing, which Charlie Stewart is leading as his role as being responsible for the operational assessment of this activity. And I think when that piece of work's done, and when we get the situation in a couple of weeks' time, as we see it, I think we will be in a position to be able to come back and say, this is what this means. It does mean that and I think it's really key, because I know this was a concern for members in fact wave one. Although we tried really hard to engage, it was sometimes making decisions very quickly without as much democratic oversight as we would have wanted. And I think the key thing here is that we want to be in a position to come back and basically say, this is what we think we can continue, and this is what we might have to put on the back burner. And I would hope to do that, if necessary, for the Cabinet meeting in November. In response to your question about South Harrow testing site, I sort of agree with what you're saying, but I also think as well it's been one of these situations where actually on the ground there has been quite a lot of engagement, and there's also been quite a lot of work done with local councillors and also the nursery and other sort of individuals within the community, because it is one of these situations where, you know, Harrow is a borough without a huge number of potentially suitable sites to establish testing in those communities where actually the advice is that will be most effective. And there was a lot of work done by officers to scope sites in and around the area, and the site that's been chosen was absolutely the best site to achieve the objectives, but it did, as you rightly point out, have some compromises and also some impacts in terms of local people. We have worked as much as we possibly can to mitigate those impacts, both working with local residents, listening to their feedback, and also working with local councillors. But I think we learn, and I think that it is an example of where you can probably never do enough communication. And certainly we will take the learning from this particular aspect to try and do even better next time.
Perhaps if I mean, what I can do is I can share with you the social media stuff I've picked up on, and it might be just one or two people that could be helpfully talked to by someone, whoever the relevant person is. I think that might be the way forward for this.
And we'll be keen to try and do that. So thank you, Paul.
Okay, thank you.
Thank you. Was there any other questions or observations? No, I'd like to make a comment really. Sean's has quite a wide responsibility across northwest London, but also London number of aspects around health. And I do as route across the West London Alliance, and I think we've done remarkably well so far. And I can say that, you know, with some strength of facts behind it. You know, that we probably could do some things better, but I think we've done exceptionally well for the position we're in at the moment. And I think, you know, when you look back, it's sort of when the pandemic crisis hit in March, the teams across the council had to develop and stand up new services right through the first wave, and that will set us up well for the second wave, or the third phase that the NHS are starting to call it. So we are in a stronger position in some sense for that. But our number one priority is people's health. And I understand, you know, what people's concerns around accessibility to places, but we need to make sure that it's in a very safe environment. And one of the things I am pleased about is the government has brought that sort of stick approach in, that we can, or the police can start issuing fines if necessary to try and control this virus. We've worked out, you know, that Public Health England have actually can understand it, that if it's a localised outbreak of the virus, they can control it, as long as people follow that guidance that's published regularly, keep that safe distance, the washing their hands and wearing a face mask in a public place. And it's those people who don't, is the ones who risk spreading the virus a lot further. I've also think in the way that we put the presentation tonight, which I'm thankful for Sean to do, is since March, I would say that this has been relentless on staff right across the organisations, not just within the council, across public health, across the health service, and even across the voluntary and community organisations, that it's been continuous, it's without a break. And I think we need to learn from how we can cope with that to move forward, because we don't want to go back into that full lockdown procedure that took so much out of people to get through that first wave. So it's that preparation that gets us ready for the second wave that's coming through. That could be up to 6 months or until a vaccine is found. It's going to be hard, but the difference is, as Paul's highlighted, you know, we've got to what do we prioritise as we go through this, but also what do we deprioritise, and so those decisions have to be made as we go through. But the way to control it is follow that Public Health England advice and stick to it. With the testing station in South Harrow, you know, we've back in August, half the testing capacity in London was moved out. It was moved up to the north because of the higher infection rates. And it's taken a lot of arguments to try and get that testing capability back. So we have to drive-in centres, which people have to book online, and it can be a challenge to do so because, you know, you could be sent anywhere. And it's because our rate is rising, we need this testing centre of that's where is likely to be needed, and those locations are hard to find. There will be some challenges around that, and I have had people contact me, but I think their priority as well is that the people, they haven't got that far to go to be tested, to give that confidence so they can still continue in their normal way of life is far more important than the I wouldn't say it's just a smaller inconveniences around passing through that site or using it for other purposes. Hopefully in the short term we could probably get a result to, you know, we can actually stop COVID from progressing around the country, and we can reduce that effect in Harrow. And I think it's because we are working across party as well. You know, we are working as hard as we can to control that, and once it goes away, we've learnt a lot. We now have online meetings. We never had them pre-March. We sort of actually have computer systems. You can sit at home and you can work away, and our staff can do the same. We're doing things in a completely different way, but many people are not seeing a difference in the services that are being delivered, and that's a credit to the staff themselves. So I'd like to say thank you for all the staff that are here. The officers are all here on the call, but I would say that as we go forward, I think the easiest way to do that is through these presentations and verbal updates at meetings to ensure that we have the up-to-date information when it's available. So with that, can we just note the verbal update where we are at the moment? There's no decision to make at this moment in time, but if there is, then we'll come back to Cabinet and answer. So thank you very much. We now move on to item number 6, which is councillor questions. And can I ask Councillor Marin Ashton to ask question 1, please?
Yes, thank you very much, Leader. This is a question to Keith Ferry, Deputy Leader and Portfolio Holder for Regeneration Planning and Employment. Does Councillor Ferry agree with adopted local and spatial planning policy? And does he have confidence in the Planning Department officers' ability to correctly interpret them?
Thank you, Marilyn. Yes, I do agree with the adopted local plan, because having been the planning portfolio holder during most of its preparation and at the time of its adoption, I also have confidence in planning officers' ability to correctly interpret the local plan policies. There may, however, be instances where planning committee members choose to give different weight to material considerations relating to a specific planning application, and they may come to a different conclusion than that recommended by planning officers. This is the prerogative of planning committee members, and it is consistent with legislation and guidance.
Yes, well, thank you for that. That's an interesting answer. It won't surprise you an awful lot to know that I'm actually and remain quite concerned about your decision that you're minded to grant the application for a massive hotel and diagnostic centre on the Hive. There have been a lot of people contacting me personally about this anyway, local residents who live particularly in Queensbury Ward, which is represented by colleagues of yours from the Labour group. They're very concerned. And so, and also, as you know, we did call it in before we got the stage 1 report, and I've got it here actually, from the Greater London Authority, which at the moment, the Mayor considers that the application does not comply with the London plan. He leaves the door open that there's a number of very serious things that need to be addressed in order for it to comply with at least the adopted and also with the draft London plan. And as you well know, your reason for saying that you wanted to grant permission for this was, gosh, what an awful noise, was quite simply that you said that you didn't agree with the policies. And you've just said in your answer to the first question that I asked, that in actual fact you've been responsible for all the policies in the local plan since 2010, which is when you took over from me. So really what I'd like an assurance on, and I hope you agree, is that before we bring back anything on this particular application on the Hive back to the planning committee, that at the very least we invite the applicant to seriously consider the stage 1 report from the Greater London Authority, and also that we make sure that we're not flying in the face of adopted policy, and that the 8 reasons for refusal that your own officers have given it on a professional basis are looked at properly, and that you take it seriously enough. It's a very big deal to overturn a recommendation for refusal, as you well know, particularly on something of this scale, because once something is granted, that's it. It's there forever. unless it can be judicially reviewed. So I hope that I can have your assurance that we'll take our time and make sure that if anything it needs to be addressed, particularly given the stage 1 report that from the GLA that we should have had in the first place before we looked at this, we won't bring this back until things are properly ready. Thank you.
I'm not sure where the question was in all of that rambling, but I'm not prepared to discuss individual planning applications during. Excuse me, I'm replying. I'm prepared to discuss individual planning applications in the Cabinet meeting. I don't think it's appropriate, and I think the Planning Committee is the best place to discuss this.
Thank you, Keith.
Much of an answer.
We do have 9 minutes left, so we can probably get the other 7 questions done. Councillor Anjana Patel. Are you there?
Yes. Yes. Good evening. Thank you, Leader. My question is to Councillor Varsha Perma, Portfolio Holder for Environment. Would you describe the Council's street space scheme as safe?
Thank you, Anjana, for your question. These schemes are put in place for our residents to support the social distancing. So, yes, we carried out safety and risk assessments on the schemes, and they comply with the current health and safety legislation.
Thank you. I have a supplementary. Can I ask? Across London, there have been reports of street spaces schemes like those in this borough, causing gridlock and delay for emergency services. In Harrow, an ambulance was forced to go on a wrong side of the road in Honeypot Lane due to traffic jam caused by one of your street space schemes. The consequence of causing delays like this could be fatal. How many emergency services vehicles will have to be delayed before you reconsider these flawed schemes?
Well, as you know, every borough has their own issues to deal with. This is the first I've heard about the incident on Honeypot Lane, but having spoken to the fire brigade, etc., they haven't said that they're having major issues. So unless you know anything else, please do tell us. So I can only tell you what we are doing in Harrow. And as far as I know, we're okay.
Thank you, Councillor. But yes, this actually happened. I'm surprised you haven't heard about it. But I will come back to you.
Councillor Pritish Patel. Pritish, are you there?
Yes, I am here.
Now you've got question number 3 to Councillor Philip O'Dell.
Yes, with respect to the HRA revenue account business plan update 2020, what alternative delivery models are being considered as part of option 2? That's for you, Councillor Dell. Sorry.
Good evening, Pritish.
Good evening.
Thank you for your question. Yeah, the council is reviewing its opportunities to build or require homes on land other than owned by the housing revenue account. So there is an investigation into alternative delivery options to complement our direct delivery. Obviously, this will be reported and the outcomes and the options considered at a future date.
Thank you. If I may ask a supplementary, Councillor Dell, what opportunity will there be to scrutinise the outcome of that delivery model exercise prior to it being submitted to Cabinet, I guess?
I would suggest probably through the normal channels. We probably brief the shadow portfolio of the housing, Councillor Bath, and obviously the scrutiny can have that go into their report. And we can also offer it to briefings if officers have the time to give briefings to individual groups.
Is there a specific time frame for that?
No, we haven't got any specific time frame because we've only just started the work on that review. But it's mentioned in this as part of our options going forward as we update the business plan.
Thank you, Councillor O'Dell.
Thank you, British. You've got question number 4, I think, to Councillor Adam.
My question is to Councillor Adam Swesky, Portfolio Holder for Finance and Resources. Councillor Swirsky, what actions have been put into place to control the slippages, overspends and underspends within each of the directorates?
Thanks, Councillor Patel. So I think a couple of things here. I mean, one is that, to put it in context, we originally set our draft budget for this year in December 2019. And when we finalised our budget in February 2019, on the 27th of February at full council, that was the same council that I stood up and said that we were making plans to prepare for a global pandemic arriving in the UK. So I don't think it's hugely unexpected that there's been some variances between the budget setting and the year as it's progressed. I think that would be expected by most people. And of course, we have ongoing conversations with directorates around all the slippages, overspends, underspends, to make sure that they're appropriate and that we have full controls in place. If your question is referring specifically to the impact of COVID, then of course I will have a lot more to say about that in the report that I'll present shortly.
Thank you, Councillor Swirsky. If I may ask a supplementary, you know as well, Councillor Swirsky, that over the last 3 years you've never managed to meet your budgetary targets. Now, so my question is, you've got a budget gap for 2021-22 at currently standing at 26.2 million, as you've referred to that in your financial MTFS update. How confident are you that this figure is accurate, considering that over the last few years you have failed to meet the planned budgetary forecast for both capital and revenue? And if I remind you, for 2017-18, you only spent 47% of the capital budget. For 2018-19, you only spent 27% of the capital budget. And for 19-20, you only spent 28% of the capital budget.
Well, Councillor Patel, I'm delighted to be scrutinised by you for having underspent consistently and therefore being able to put money into reserves that better enable us to prepare for and have resilience against shocks like COVID-19. So I'm very happy to come to you year on year and say, well, actually, we did underspend our budget a little bit. We put some money back into the reserves, and that's meant that we don't have to make cuts to frontline services in future. I'd much rather have to explain myself to you on those grounds than tell you that we've overspent our budget and that we're going to have to make more cuts to frontline services. So I'm proud that our teams have been very prudent and that we've been able to put money aside to prepare for unforeseen events. And in respect to capital, well, you know that in particular for this year, we had a strategy which we set out about a year and a bit ago, which said that we were going to look at making investments. Clearly, that's no longer a strategy we want to pursue for obvious reasons. And that's a very significant portion of the capital underspend. There's also challenges that we've talked about in this forum in other occasions about how you set a capital budget in a way that makes sure that teams have the capital in the programme so that they can get on and deliver the programmes, but also recognising that capital programmes are subject to all kinds of challenges, whether external or internal, and so on. Things change all the time with large capital projects. So we're in a very comfortable position to say that we continue to be incredibly prudent, and that's put us in a much better position than some other authorities facing this enormous global shock.
I'm surprised that you feel proud of that achievement. In many other organisations, if you had such variances, you would have been fined.
Question number 8 has been withdrawn, and we haven't reached the 15 minutes within the allowable time. We only have 3 questions left, so if we don't dilly-dally, I'm sure we can get through all 3. So, Pritesh, have you got question number 5?
Yes, thank you very much, Leader. To Councillor Vasha Palmer, Portfolio Holder for Environment, what research was done for the implementation of cycle lanes taking up 1 full lane of a dual carriageway on Uxbridge Road in Harrowfield?
Thank you, Pritesh. As I have said previously, that these measures were put in place temporary due to the crisis so people can cycle safely. Now, there is legislation about the width of the cycle lane. However, when putting in any cycle lane, we follow the safety and TfL guidelines which are set and our own local information. this is also forms part of our walking, cycling, sustainability transport strategy, which was approved in 2019 and sets out the borough cycling aspirations, the network and the delivery plans.
Thank you very much, Councillor Palmer. I note that your response to the question. However, the cycling lanes, as we see it, and many of the public see it, as schemes that have been poorly implemented and without thought to existing road users. Taking up one full lane for use by cyclists has unnecessarily resulted in increased vehicular traffic, as well as pollution on Uxbridge Road during peak hours. It has also had a side effect of increasing the risk of collision between cars exiting some of the side roads on Uxbridge Road and those merging into a single lane at Oxley Lane Uxbridge Road junctions, especially at the roundabout. Similar experiences have been noted in other parts of Harrow where these schemes have been implemented. I understand that these were temporary in nature, as you've just said. How long is the temporary period for? When will a review be conducted, and what criteria will be used to justify their retention or renewal or removal?
Okay, so temporary is 6 months, or now with the second wave, it's all echoed, sorry. However long it takes, but we said in Tarsat meeting that we would review them every month, and that is what we do. The reason about drivers have responsibility as well, so you can't say because the cycle lane is wide that people are driving and causing issues. Everyone has responsibility, whether you're a driver or you're a cyclist. There is a reason why there is a width there. We are following the guidelines that were given by your government. So, to say that we don't know what we're doing and things like that, we're following guidelines, we're following legislation that has been given to us for the safety of the residents due to the crises. And with the second wave, we don't know how long it's going to last. We review it every month and then we see what happens. There are criteria and review criteria that we ourselves are putting in so that we can monitor and ensure that it is safe. But it is up to the drivers as well to drive safely and follow all the rules, regulations of the highway code.
I think you'll find that blaming on the government all the time is probably not a wise thing to say, because a lot of the times it's up to us to implement schemes that are sort of safe for our own residents.
I wasn't blaming the government. I am saying we are following guidelines of the government.
Someone's take my mute button away. We're not getting conversation because we're overrunning the time, and I wouldn't want to deprive Councillor Ormond from asking his 2 quick questions. Richard, would you like to ask your very quick questions?
Thank you, that's very kind of you. Can I say in relation to question 8, we're going from one extreme to another with my questions. My June ones took 3 months to reply. Question 8 was replied to yesterday. So I'm grateful for that, and it did achieve something. Anyway, this question to you, Leader. If our public meetings are not to return to the Civic Centre, where will they be held and from when?
As I said last month, it's a very similar question that I would like to go back to more non-virtual meetings in effect. But given the current government restrictions on public meetings, we are planning that all our member meetings will be virtual and online for at least the next 6 months.
It was a different question. If it hadn't been, it wouldn't have been allowed. In reply to that question, Leader, you said, we have done testing on the Civic Centre capability of having meetings, and it isn't suitable to arrange for these meetings to take place. The numbers are so small that it wouldn't manage it in a safe environment. Now, that sounds to me that the answer as regards the current Civic is we will never return for public meetings. If that's the case, can't you just say so? Make arrangements for where they will be held alternatively and tell us what you're doing, because we can't carry on as we're doing now until the next Civic Centre is built, because nobody has any clue as to when that'll be.
Well, I don't know. I thought we were getting quite good with these virtual meetings, and more people are joining in and has capability of access. With the Civic Centre itself, it's because the ventilation and air quality is not suitable to hold meetings in there. Now, if there's a vaccine pops up next week and everyone's vaccinated and the COVID virus disappears, then we'd revisit it and look at reintroducing face-to-face meetings. At this moment in time, there's nothing that can be really done to the Civic Centre to make it a viable option to be used at this level of the COVID pandemic. If suitability is, as we move on, that the we move on with the Civic Centre site and work out what to do with it, and it extends into the future, we will be sort of taking guidance and consulting around how we do deliver the public meetings going forward. But like you, I think we're one of the two people I think would like to come back to those physical meetings and have a proper sort of discussion. But at the moment, we're staying with the virtual meetings. So thank you. Did you have question number 7 as well, Richard?
Yes, this is to Councillor Palmer. I hope she won't be politically contentious in her reply to me as she has been earlier this evening. What was the point of the Street Spaces programme briefing to head teachers on the 29th of September?
Thank you, Richard. And as I'm doing with you, answering their question and their concerns. So just to clarify, Mike was invited by the Children's Director to participate in this monthly meeting of the directors and heads, which covered a wide range of subjects, including street space on this particular one. So that is why that happened and the teachers had the briefing. Following on from this, I'm very pleased to say that we had a positive feedback and the teachers want to have further engagement with us.
The head teacher of the school of which I'm a governor, which I mentioned in declarations of interest, and she knows I'm raising this and has consented to it. She says that they were told to get in touch with the officer if they had concerns about aspects of street safety outside their schools. She did so, asked for an assessment of the traffic on Long Elms, and I've been there and witnessed it in the morning and in the evening, and it's very bad because 3 schools share that space. She gained the impression from that if they submitted concerns, there would be some sort of support for them, but the reply came back simply that as TfL had withdrawn its funding for the normal programme of street works, there was no money for it, and that was it, which disappointed her in the extreme. So the first part of my supplementary is, why was that invitation given if the reply was simply going to be there's no money, so there's nothing we can do? But then the second part is, subsequently she has been told that you may be getting some money from TfL later this month. So is that right? And if so, do you know what sort of sum we're talking about?
Okay, that is correct. We don't have further money from TfL. The money we had from TfL was for the street space, and therefore Michael was explaining about the current scheme. Okay, so there is money available, which we have bid for next month. I haven't got the figures in front of me, so I can find out for you, Richard, and have the officers let you know. But it wasn't that the officers were being unhelpful, but that is the truth of the matter, that TfL have withdrawn all the funding that we were supposed to get for our bigger program, and the only monies we have at the moment is the for safety streets, which is a street space scheme at the moment, and they're doing in tranches, so we have to bid for every scheme, and then they review and say yes or no.
Thank you. Thank you. That does conclude the questions, but I'll just make a comment that we must remember as well that our LIP funding, which deals with our road safety programme, was stopped as part of the challenges that TfL faced, which is £1.3 million. So we're not getting that funding. So the only funding we can get is where we bid into the government statements and allowances. We have to bid into it. We bid in for 38 schemes and we got less than that coming back. But we will continue to apply for schemes where there is support for these programmes going forward. That now moves us on to item number 7, which is the key decision schedule for October to December. A number of items have been deferred. So the following items have been deferred from October to the December Cabinet meeting, which is the approval for consultation for the Edgware Town Centre supplementary planning document, which is being jointly prepared with the London Borough of Barnet. and also the Harrow Statement of Community Involvement amendments in response to COVID-19. They've been deferred to December. The report on the planning white paper, proposals and implications for Harrow, including outline responses to consultation, has been withdrawn from the key decision schedule. So can we note the completely amended key decision schedule, please? Thank you. Right, so now we move on to item 8, which is progress on scrutiny projects. Can we note the update, which is on page 15 of the published report? Okay, everyone's nodding assent. We now move on to the Housing Revenue Account Business Plan Update 2020. And can I ask Phil to introduce the report, please?
Yeah, thank you very much, Graham. Good evening, everybody. Yeah, the basis of this report is to give Cabinet members an update on the HRA business plan. So far, I'm pleased to say that this plan has delivered 95 new homes as part of our ambitious plan to build 659 homes, council homes in Harrow. The report sets out assumptions to be made as part of the update of this plan, as tabled in Appendix 1. These include inflation, rent levels, right to buy sales, and of course continued access to external funding. The report also sets out that the council will continue its progress to constantly review how the homes may or may not be delivered. First of all, the current plan considers delivering through the HRA. We have an option to have an alternative delivery, already mentioned there, to tonight to support the HRA, and the third option will be a combination of both. There is a fourth option on the papers, and that's to curtail the scheme altogether. Presently, this is not being considered as an option for the people of Harrow. As the recommendation sets out, work will continue on these options, and this will be, as I said earlier tonight, part of a further report. Harrow desperately needs generally affordable housing, and this business plan seeks to deliver some of those housing for the people of Harrow. I ask Cabinet to fully support the recommendation on page 18.
Thank you, Phil. Adam, your name's also on the report. Did you want to add anything to what Phil's saying?
I think Phil said it really well. I mean, I think the report sets out it's been a challenging process over the past few years with the housing revenue account because of some of the changes that the government made that took away much of our long-term funding. But we have now got to a position after a lot of hard work to repair the position. And if you look at the forecasts now, they're actually pretty positive, which puts us in a good position to weather future storms in the housing revenue account. But most importantly, to make sure we deliver on those plans that Phil mentioned of over 600, well over 650 new council homes. And it's so impressive to see that we're now into the close to 100 homes already delivered. And we think about the position we started from, not a single home built in a generation. I think that's a huge amount to be proud of as well.
Thank you, Adam. We have one hand, which is Paul. Did you have a question?
Thank you. I mean, I did struggle to understand some of this report. I mean, obviously I got and understood and welcome the additional council houses, but the rest of it just seemed, I mean, the wording in recommendation 1, I think, confused me for a while. I think it implied that the update would go to Cabinet in December rather than the HRA budget. It took me a while to get my head around that. And the alternative delivery models, other than I understand that they're alternative, there's very little detail as to exactly what they would be. And I think it would just be really helpful for me as someone who's not an expert on the HRA, just to understand a bit more about what alternatives you're looking at and what the relative merits of those were. And I was also just on some of the assumptions seem to be in I think paragraph 16. They set the assumptions, but they don't say how we're doing against them at the moment. And some of them are 2021, some of them are 2020. I don't really want to go through them, but I just wasn't quite clear where we currently are on any delivery against those assumptions. Some of them we passed a few months ago, some of them are for next year. I think just be helpful It's especially, I think, H, I, and J I had some issues with. And just finally, we seem to have decimalised and put into money years in Appendix 2, which again doesn't necessarily help when you're trying to understand these things. But I just think if Councillor Adele or indeed officers can just, because I know Councillor Pritish Patel asked about this, but I still didn't get from your answer exactly what alternative models were being looked at and how much of that target might be delivered by these alternative models.
But there may not be a need to have any of those alternative models, but the work has just started on that because we want to be prudent and we want to try and achieve that ambition to build over 600 new homes. And as I said very earlier twice, we will be reporting on that. I'm sure your shadow portfolio holder, Councillor Bath, has already had a briefing on these. Perhaps you can ask her to ask more questions, or if you want to have a separate briefing, I'm sure the officers can arrange that to answer your questions around those assumptions.
Thank you, but can you just talk me through like one or two of what the alternative models actually look like? I mean, are there examples in other boroughs where they've done these alternative models that we can look at? Because just to say they're alternative to the council delivering them, I mean, there's a huge range of possibilities. So just curious, have you set any parameters for officers to look at? Are you on mute? Bill, you're on mute.
Yeah, talking about other London boroughs, you can look around other London boroughs, like London Borough of Barking and Dagenham, probably Tower Hamlets. They've joined up, some of them have their own housing companies to deliver them. Others choose to have joint ventures, like Haringey, to deliver their. So they are the type of options that we may consider. The work has only just started on that. As I said previously, we will be reporting on that. And as I said earlier, I think Councillor Bath has also already had a briefing on that, hopefully, as your shadow portfolio for housing. And if you have any further questions, I'm sure Nick Power, Head of Service, can arrange for those questions to be answered at the appropriate time.
Thank you. I think that would be helpful, especially obviously in the run up to December and February when we set the HOA budgets. Thank you.
Thank you, Phil. Was there any other questions? I'll just reiterate the points that was been made previously on this report when it's come to Cabinet in the past, is that the rents were actually going down by, as a negative increase and such, which caused a major impact on the budgets. And within the assumptions that are there, it's making a lot of assumptions that the CPI would be above a positive figure rather than a negative, which it could go to if we have an economic downturn. So where before we had the CPI plus 1% for council tax increases, you could actually set out a long-term business plan with some certainty. And at this moment in time, it's probably a lot harder. So the challenges are there, but the outcome we're facing is, when you're asking your direct question, what outcomes do we want, is to actually increase our council housing stock. Because one of the other challenges within there, in the HRA, is if there was a mass increase of people actually buying the properties under right to buy, we would actually make a massive impact within the overall financial strategy going forward. So there is assumptions in there based around what we know at this moment in time. And I think that's the fairest thing to do, I think. But I'd like to congratulate the staff for actually coming up with a positive way forward to actually deliver a lot of things in a very challenging environment. So the recommendations, as Phil's pointed out, are on page 18. Are they all agreed?
Agreed.
Excellent, thank you very much. We now move to item 10, which is the medium-term financial strategy update. Adam.
Thank you very much, Leader. And you'll notice we don't normally have one of these types of reports in October because we, at this stage of the year, we're preparing our draft budget, which we present in December. But it has been an eventful year, I think we can all agree, and there have been huge impacts on our finances. And so we thought it was prudent at this stage to present our position currently, to talk about the impact of COVID on our council finances, to show what that means for the current year and also for our future budgets as well, and discuss some of the actions that we're taking to deal with it, but also the outlook that we're facing as we prepare our draft budget. And in the interest of full transparency, I think it's really helpful that this report has been put before the cabinet. So if you look, taking those things in turn, if you look at the impact of COVID, we've been providing regular updates to MHCLG on the lost income and also the additional expenditures that we've incurred. The current forecast is that the total impact of COVID will be £36 million for the council. That's about £13 million of additional spending and about £23 million of lost income. So that's everything from providing PPE to our social care teams to providing more funding for social care providers, and of course lost income from things like council tax not being collected because of the economic situation, business rates, and all the rents and charges that we normally have as part of our income base. Now, we have received a roughly £20 million grant from central government, which has of course been very helpful, but you'll notice that does still leave a £16 million gap that we're facing, £60 million of additional spending and reduced income that we wouldn't have had we not had to face up to COVID-19, and of course do all the things that we've done to make sure that some of the things that Sean talked about earlier, to make sure that our council was supporting our residents, supporting our businesses at a time of enormous need. So what does that £16 million translate into in terms of our financial position? Well, this year, thanks to enormously hard work from all the officers to keep tight reins on spending, to make sure that we're being prudent, and of course, further to what Councillor Patel was asking me earlier, the fact that we did have some underspends in the previous year meant that actually we did go into this year in the best possible position, which means that this year we think we'll actually come out okay. Now that's partly because of the way that lost council tax income impacts us. It doesn't impact us this year. What actually happens is that it ends up flowing into next year. So we'll be okay this year, and of course we will continue to squirrel away any spare funds that we can, because the position in the next couple of years is truly dire. So we went into this budget round facing £22.6 million gap over 2 years. That was £22.6 million of funding we'd have to find in order to keep a balanced budget over the next couple of years. Now, if you look at the impact of COVID, depending on our forecast lost income in future years, we'll have a gap just next year, or a total gap of the next 2 years, of between 33 and 41 million pounds. And just as a reminder, that's of a total a discretionary spending of around 170 million pounds. So we're talking about somewhere in the region of a quarter or a fifth of all our budget is the size of our current gap. Clearly a huge challenge that we're facing up to. There are some actions that we're taking though. We are reviewing the position with all directorates, looking at all budgets and seeing what can be done, both in terms of maintaining those tight reins on spending, making any efficiencies that we can, but also making sure that if there is lost income that can be recovered, well, that we're doing that. We're looking at our assets, of course, and we do benefit at the moment from something called capital flexibilities, where we can use, if we do have assets that we don't need anymore, legitimate ones, of course, we are as a council net investors in Harrow, but there might be some assets that we don't need anymore, and we can sell those, use that to support some of our plans in the council. And then, of course, looking at our capital programme, as Councillor Patel says, it's quite right that this year we aren't spending all the capital that we thought we might, and a big part of that is the property investment programme, which we're not going ahead with. Well, there's a big opportunity to review our capital programme and see whether we can make some savings by taking out some of that capital spend as well. I should add an action that's not maybe fully laid out in the report is that we continue to advocate strongly directly to officials and ministers in central government the really challenging position that we face, but also all councils face, and indeed some are in a much worse position than us, and making sure that they're aware of the need to provide councils with a sensible funding settlement, not for our own good, but so that we can play our part in continuing to support residents and businesses through a second wave that we're now facing, and also through the economic recovery that's much needed. And I conclude just by saying that, you know, we are in a position, we always face huge uncertainties in local government, but I don't think in my time as the finance portfolio holder that we've ever faced such great uncertainty. And we are as a ship in the night, and there are icebergs everywhere. And that's the position that we're in. And the government should be playing the role of a lighthouse, but instead they're acting more like a fog machine, making it harder for us to see the way forward rather than easier. So we hope that the government will provide a bit of a path and show us the light and show us the way forward, and ensure that we can properly fund all our services in future. But you know, realistically, we think we're in a position where uncertainty is going to be at a greater level than even we usually face. It's going to be a fact of life that we'll have to deal with for some time to come.
Thank you, Adam. We have two hands up at the moment. Sean, Chief Exec. Sean, are you there?
I am there, Chair. Thank you very much. I just wanted to very briefly mention that myself and Dawn Calvert, the Director of Finance, have been meeting with our local MPs over the last week in order to make sure all three of them have a clear and effective understanding of the council's financial position and the information that's contained both in this report and also the submissions that we have made to both the comprehensive spending review, but also within the meetings that we've been having with MHCLG officials, because I think it's very important that you know, across the council and across the broader political leadership within Harrow, that we are as effective as possible at explaining all of the things that are contained within the report that has been prepared. So I just wanted to make sure that the Cabinet and members generally were aware of that aspect of the lobbying and information work.
Thank you, Sean. Yes. Paul.
Thanks. I just wanted to, I mean, obviously this is a report with no actual decisions, it's just a load of things for noting. But the thing that I noted was particularly paragraph 3.27, which is referred to in the recommendations, and it outlines the choices that face the council. I mean, first of all, I'll point out that the second and third choice seem to be pretty much the same choice, which is to use the reserves. It's really a question of, I think, do you use them in year or do you use them in future years? And then there's a option of the council could have a dramatic programme of cuts. First of all, it doesn't seem like the council is actually making any choices at the moment, which I think is not necessarily the best way forward. I also think there is something short of embarking on a drastic programme of cuts to address the budget gap, and instead maybe looking at bringing forward some of the measures that we might have taken in the next financial year to try and get savings earlier. There's looking at some of the things that the Chief Executive presented in future years. There's maybe looking at some of the capital programmes that we might not necessarily need to do. For example, building a new civic centre. Instead of doing that, we might decide that we actually want the revenue that we could get from those sites and actually get some revenue value from those sites rather than the undoubted value, but nevertheless not quite as same in pure financial terms revenue from a new civic centre. I just think some of those options could be being addressed now, and I know obviously they will be in the draft budget in December and no doubt hopefully in the full budget in February, but just it would have been helpful to set out some of those things in this report. That's what I was expecting when we were talking about this report over the past few months. I know this does set out a lot of the challenges the council face. It just doesn't set out many of the solutions other than relying on central government, which I'm sure the central government will come through and will be very generous to the council. But in a prudent planning sort of way, I would also have some other plans in my back pocket.
Well, thanks, Paul, and I think there's a very constructive comments. I'm not quite as confident as you that central government will pull it out the bag, but I know that you have better contacts than we do, so I'll trust that you will be making those links and doing some of our lobbying for us. I mean, I think it's fair to say, I mean, it's a good challenge, but it's fair to say that we when we think about this, we sort of divide our choices into two, or our approach into two. The one is essentially what might call typical budget management, which is to say, we have for the last decade, kept a very tight rein on spending. We always look at our, for example, the capital program is a good example of that, where, Councillor Patel was very worried that we're about how we're spending our capital program. Well, one of the reasons why, we don't just spend all the money that's put into the budget is because it's put into the budget. But actually, for anyone to access that capital, it's got to go through Capital Forum, which is a process where business cases presented, at the right moment, capital's then unlocked, and the money is allowed for departments to spend. So, as a matter of course, there are a whole range of things we do to make sure that we're not spending any unnecessary money. And so, I think it's fair to say that many of the things that you would have talked about in terms of what falls short of a program of drastic cuts would fall into that camp of, it's not going to be matters necessarily the cabinet will be drawn attention to, but actually it's just a matter of course that we're very cautious about our spending. There's a second approach, which would be to say, right, we're actively going to reduce our service offer. We're actively going to make additional cuts because we need to, we can't wait to hear from central government. We're going to run out of money if we don't make those cuts. And that is a choice that is being made by many councils across the country right now. But I think Harrow is in a better position because we have been so prudent over so many years and so cautious about our spending, almost to a fault, that we're now in a position where we don't believe it's the right course of action to be coming to cabinet and saying, here is a list of services that we can't afford to offer anymore. Here is a list of things where we're going to have to reduce our offer, because what we do have instead is a set of reserves that we hope we don't have to use, because it's important that we have those, but that were central government, where your close friends in the cabinet not to deliver for us, we know that we'd still be okay through next year. So that's the position that we're in at the moment. We think that if we would make those cuts today, then that could potentially put us in a significantly worse position, were central government to say, okay, here's a little extra money, we would have made the cuts, caused huge disruption, caused huge damage to people in Harrow, and actually we didn't need to do that. So that's the balance that we're trying to strike. But I think it's a very fair challenge to say, actually, there's a whole set of activity that you're not necessarily seeing in this report, which is nonetheless underway to keep a tight lid on our spend.
Yeah, I mean, if I could just come back very briefly, I think, especially if you have capacity within the capital programme because you're not doing certain things, there might well be other things that could generate savings in year 2 or year 3, that the sooner you start them, the sooner you start delivering those savings. And I just think, and I get that obviously capacity is difficult at this moment, given everything else that's going on, but one of the priorities was budget planning and the MTFS. So, some work on what sensibly could be done in terms of changing services, not necessarily cutting them, but doing them more efficiently, or investment in IT that might well result in a service being able to be done more cheaply and more effectively.
Yeah, and I guess what I'd just say is that I wouldn't underestimate the number of things that are already underway which have come to cabinet in the past. I mean, our IT modernisation programme is enormous. I think if we added one more thing to that, I think our IT team would probably run away from us, because their program of work is so huge. So I think there's a long list of things that are absolutely underway, and I think we're always looking at what are the next set of ideas that we can bring to the table to make things better, more efficient, more effective, and so on. I don't think that making changes to a move to a civic centre in 3 or 4 years' time is going to help us with the budget over the next couple of years, but we're always open to ideas if you have some, Paul, in terms of the services that could be improved.
I mean, one of the things that, and I know this is all, so I'm just trying to help here. one of the things that I know is on the list to be done, and I'm not sure the exact timeline for it, but I know planning officers are spending a lot of time on a planning IT system that's not fit for purpose. And if any bits of that can be brought forward, that would release a lot of their time to do more stuff and therefore enable that service to be delivered more effectively. I know some of the really big planning applications, a lot of officer time was spent just getting the data onto the website rather than actually doing the plan. And I think there's a whole load of things like that across the piece that I think could usefully be brought forward.
I mean, you're quite right. I couldn't agree with you more. And obviously that planning system is currently being upgraded. And so, to the extent that we can bring that forward and do it quicker and faster, I'm 100% with you.
Thank you. I can't see any other hands up, and it is the medium-term financial strategy update. But I would say it's something we've said for a number of years, that austerity has cut our services to the bone over the last few years. And with our grant disappearing, we've had to work hard to deliver a number of services under a very challenging background. And to be honest, we are recognised as one of the most efficient councils in London, and probably out of London as well, but you've got to do it as a borough, a London borough. So I'd like to thank the Adam and the finance team for actually steering a lot of that to make sure that we can get through where we are, because we entered this COVID crisis with budget pressures already, and as Adam pointed out, we've got a £22 million at that time, as a £22 million budget gap from next year. But we didn't hold back because we got told by the minister that we would be funded for all the expenditure that we had and loss of income, and that hasn't come through, and that's something we will be pursuing, and we have been pursuing for the last few months, because that has left us a gap in our budget. And the other part of it all is when we look at saying, can you change some minor things around the budget, or can we change a planning system, which was the example used? In reality, as Adam has pointed out, at this moment in time, if the government doesn't give us any more funding or come out with proper funding agreement, we've got a £33 million budget gap, which is nearly over 20% of our overall expenditure. And there's no organisation can cope with that when it's already running as lean and as efficient as it can do. The only option will be eventually is to either look at either increasing costs somewhere or just sort of stopping services, and it's not something we would like to do. But when you look through the rest of the report, it sets out some of those pressures that are coming through. The decisions that are made at a national level are impacting. So the bailout of TfL and saying that's under 18s transport, that could put a cost on the council, a strain on the council of £860,000. When we look at the new homes bonus, we're hoping we will get it and it will flow through. There's no announcement made. And paying non-inflation, if inflation goes up and the costs go up, that could even cost another £2 or £3 million. These are all significant figures, and little changes won't absolve us from that. And on the previous report, on the housing report, you were saying about uncertainty and sort of very wishy-washy about it. We won't be able to set a budget, a proper budget, until we know what the government's going to announce in December. Now, they might come back, as you're quite confident they'll come back on and say that we will be properly funded. But unless we are, we do have a significant budget gap to deal with, and I'm confident the team will come up with some proposals at the cabinet report that reflect the position we'll be in. But it's not a very rosy picture when you see a number of councils around the country are having emergency budgets at this moment in time to try and get through to the end of this financial year. Adam and the finance team have worked hard, and as Sean has said earlier on, exceptionally hard to manage those costs so we know where they are and look at full cost recovery at a later date and how we deal with that. So it is prudent use of reserves and things that's got us to this stage. The recommendation, as rightly pointed out, is to note the report. Sorry, there's a number of recommendations. So it's notes all that there's 5 recommendations on the report. Can we and the reason for the recommendations is actually there. It says on the update on the estimated impact of the COVID-19 pandemic on the council's already challenging financial position over the medium term. So are they all noted, please?
Noted.
Thank you. That concludes all items on the agenda. Oh, sorry, any other business? I haven't been notified of any other urgent business. So that concludes the meeting tonight. Thank you all for your attendance, and we will see you very soon. Thank you.
Thanks.
Good night.
Good night.